If you ever had sudden severe pain in your back or side that won't go away, your body isn't just being dramatic. It might be forming kidney stones. And trust me, when that stone decides to move, you will understand why people say it's worse than getting hit by a truck. What I'm about to tell you might make you uncomfortable, but it could save you from an emergency room visit at 2 a.m. I am Dr. Maulesh Tolekia, a senior urologist and andrologist. Over the years, I have treated thousands of patients with kidney stones, and here's what I have noticed. Most people who end up in my emergency room at 2 a.m. crying from pain had warning signs for months. They ignored the occasional backache, the slightly pink urine, the burning sensation, thinking it would just go away. But kidney stones aren't random bad luck. There's your body's way of screaming that something in your lifestyle or health needs to be changed. Every stone tells a story about what you are eating, what you are drinking, or what's happening inside your body. And today, I am going to teach you how to read those signals before it's too late. Quick question. What do you think is the number one cause of kidney stones? Most people say too much calcium or eating the wrong foods. Actual answer? Not drinking enough water. That's it. Something as simple as dehydration causes most kidney stones. If you have ever had a kidney stone, or if you know someone who has, write ouch in the comments. Let's see how common this really is. Let's be clear about what we are talking about. Kidney stones are hard, crystal-like deposits that form inside your kidneys when certain substances in your urine become too concentrated. Here's how it works. Your kidneys filter waste from your blood and make urine. Normally, this urine is dilute enough that minerals stay dissolved. But when you don't drink enough water or when you eat certain things, your urine gets concentrated. These minerals start sticking together, first like sand, then like pebbles, and eventually like actual stones. Some stones are tiny, like a grain of sand, and you might not even notice when they pass. Others can be the size of a marble or even bigger. Those are the ones that cause unbearable pain. And here's the thing, that stone didn't just appear overnight. It took weeks or months to form. Your body was trying to warn you. So let's talk about what causes them. This is the number one cause I see. When you don't drink enough fluids, your urine gets dark and concentrated. All those minerals, calcium, oxalate, uric acid, start crystallizing because there is not enough water to keep them dissolved. Think of it like making sugar syrup. Add little water to sugar. It stays thick and crystals form. Add lots of water. Everything dissolves. Same thing happens in your kidneys. This one surprises people. They think stones are about calcium, but it's actually salt that's the problem. When you eat lot of salt, like namkeen chips, processed foods, restaurant foods, your kidneys have to get rid of that extra sodium. And when sodium goes out in your urine, it pulls calcium with it. More calcium in your urine means more chance of calcium stones forming. It's that simple. Now, oxalate is a natural substance found in many healthy foods like spinach, almonds, chocolate, tea, beetroot. In normal amounts, they are fine. But if you are eating this in excess and not drinking enough water, oxalate combines with calcium in your urine and forms calcium oxalate stones, the most common type. High animal protein diet, red meat, eggs, fish in large amounts increases uric acid in your body. It also makes your urine more acidic. Both of these things promote uric acid stones. And if you already have gout or high uric acid, you are at even higher risk. Sometimes stones aren't about diet at all. They are telling you something medical is wrong. Hyperparathyroidism means your body is releasing too much calcium into your blood. Gout means high uric acid. Obesity and metabolic syndromes make your urine acidic. Recurrent UTIs can cause infection stones called stovoid stones. If you keep getting stones despite drinking water and changing diet, you need blood tests to check for these conditions. And finally, genetics plays a role. If your parents or sibling get stones, you are more likely to get them too. Your body chemistry is just wired that way. Now here's what everyone really wants to know. If you have a stone right now, what happens next? Do you need surgery? Will it pass on its own? Let me break this down by stone size. Good news first. If your stone is smaller than 5 to 6 millimeters, it will usually pass on its own. About 70 to 90% of small stones pass naturally within few weeks. We call this medical management. Here's what we do. Drink lots of water, 3 to 4 liters a day to flush it out. Pain medication like diclofenac for the discomfort. Tamsulosin, a medicine that relaxes the smooth muscles of ureter and helps the stone pass easier. Antibiotics, if there is any infection. You will pee into a strainer to catch the stone when it comes out, and we will analyze it to prevent future ones. Now, we are in the grey zone. Some of this might pass with medication, but many need a little help. We might try tamsulosin first, but if it's not moving or causing too much pain, we will do a procedure. If your stone is bigger than 1 centimeter, or if it's blocking your kidney and causing severe pain or infection, you might need a procedure. We have several options. First, URS, ureteroscopy with laser. This is the most commonly procedure performed nowadays. We pass a thin camera through the urethra and bladder into the ureter, find the stone and break it with a laser. You go home the same day or maybe next day. There are no cuts and no scars. Second, RIRS, retrograde intrarenal surgery. Similar to URS, but with a flexible scope that can reach stones inside the kidney itself. Again, laser helps them to break the stone. Number third, PCNL, percutaneous nephrolithotomy. For very large stones bigger than 2 centimeters or staghorn stones that fill the entire kidney, we make a small puncture in your back, insert a scope and remove the stone from the kidney. This needs a couple of days of admission in the hospital. Fourth, ESWL, extra shockwave lithotripsy. It's a non-invasive option. Shockwaves from outside your body break the stone into small pieces. Works best for kidney stones less than 1.5 centimeters. You are awake or lightly sedated. Takes about an hour. The good news is all of these procedures are very effective and safe. We choose based on stone size, location and your overall health. Here's something important. Not all stones are the same. Once we analyze your stone, treatment changes. Like calcium oxalate stones. They are the most common ones. Reduce salt and oxalate-rich foods. Increase water intake. Sometimes we give medicines like thiazide diuretics or potassium citrate. Uric acid stones. For the treatment of uric acid stones, we ask patients to reduce purine-rich foods like red meat. We control gout and we use medicines like allopurinol to lower the uric acid levels. We also use potassium citrate alkalizers to make urine less acidic. Steroid stones. They are also called as infective stones. These stones form because of repeated infections. They need very long-term antibiotics and require complete stone removal because they never dissolve on their own. Cystine stones. They are very rarely found and they are mostly genetic. We advise patients to have lots of water, alkalize urine by using alkalizers, and sometimes we use medicine called tiopronin. This is why catching the stone and getting it analyzed is so important. It tells us how to prevent the next one. Let me be very clear about what happens if you ignore kidney stones. They don't just cause pain. A stone blocking your kidney can cause kidney infection, which is called as pyelonephritis, and it can present as fever, severe back pain, and can lead to kidney sepsis and long-term kidney damage. Prolonged blockage can kill the kidney tissue and cause complete kidney failure. I have seen people lose kidney function because they kept postponing treatment. Don't let that be you. Here's your prevention plan, and this is the most important part of this entire video. Number 1, drink 2.5 to 3 liters of water every day. Your urine should be light yellow or clear. If it's dark, you are not drinking enough water. This alone prevents 70% of stones. Number 2, reduce salt intake. Aim for less than 5 grams per day. Check food labels. Cut back on packaged snacks, pickles, papad, processed meats. Number 3, moderate amount of animal protein is good. You don't have to become vegetarian, but limit red meat to 2 to 3 times a week. Balance with plant proteins. Number 4, don't overeat high oxalate foods like spinach, almonds, chocolate, tea. Just don't have them in excess every single day. And when you do, drink that extra water. Number 5, eat citrus fruits like lemons, lime, oranges. This contains citrus, which actually prevents stone formation. Nimbu pani is your friend. Number 6, maintain healthy weight. Obesity increases the stone risk. Even losing 5 to 10 kgs can even help. Number 7, get regular blood test if you are a repeat stone former. Check calcium levels, uric acid levels, parathyroid hormone levels. Find the root cause. Listen, kidney stones are one of the most painful things you can experience. Patients tell me it's worse than childbirth labor. But here's the truth. The most stones are preventable. Your body forms stones when something is out of balance. Usually something as simple as not drinking enough water. So, if you have had a stone before, this is your wake-up call. Change your habits now. If you are having back pain, blood in urine, or burning while passing urine, don't wait. Get it checked. A simple ultrasound or a plain CT scan can find stones before they cause a crisis. If this video helped you, hit that like button. Subscribe for more practical urological health advice. And tell me in the comments, have you ever had a kidney stone? What did it feel like? Let's talk about it. Take care of yourself. Your kidneys work 24/7 to keep you healthy. Give them the water and the care they deserve. I will see you in the next video.